Hi, Design-a-thon participants. My name is Brittany Straub, and I'm an occupational therapist here at UNC's Acute Inpatient Rehab Facility, and I am here to present you with your Makerspace Design-a-thon problem. And this is a problem that is very systemic in regards to healthcare, and that is falling within the hospital. As a healthcare worker, one of our biggest goals is to make sure that anyone in our care does not get worse, does not get hurt while they are here. But unfortunately, falls are something that every single hospital facility that you would ever work in will be dealing with. When people are in the hospital, they've had a change in status, whether that means that physically or cognitively they are not operating at their baseline. They are at an increased risk of falls just inherently in this environment. But particularly here in rehab, we have a very different culture. Over in a lot of the other hospitals, or a lot of other parts of the hospital, a lot of other units, their culture is generally one of being in bed and resting, and patients should not be getting up. But in rehab, we want our patients moving. We do 3 hours of therapy a day. Our nurses are all trained in being able to mobilize people. We want people out of bed. We want people moving. But one of the challenges that comes along with that is that people try to move without us. Here in rehab, we employ a lot of different methods of keeping safe, including bed alarms and share alarms. But when looking at our falls data, one of the things that we consistently see is that patients who maybe don't need an alarm from a cognitive standpoint are still falling. And one of the reasons that they are falling is because they can't find their Callbell. So this is a very typical hospital Callbell. This is the same kind of system that I've seen everywhere I've been in my 15 years of practice at this point. Most hospital systems are very similar to this. You have your actual call button with your red nurses button saying, hey, come help me. They do have different buttons here that signify if they want help for pain or for pain or for bathroom needs or for water. But it is a general rule. We want patient to push one of these buttons when they want to get up and move. Now, unfortunately, this thing loves to hide. In our hospital beds, it will get messed up in the linens. It will fall down between the crack between the mattress and the bed rail. The cord inherently kind of pulls it back to the wall. So when someone's in a recliner, it's very common for it to fall off their tray table or to fall off the arm of their recliner and then them be unable to retrieve it. We have actually noticed a trend of patients falling out of our recliners for trying to retrieve one of these. And that's what your problem today is going to be, is how can we make this Callbell more accessible, easier for people to find and to see and to use. Now, there's a few limitations that I just want you to know right off the bat with these Callbell systems. I think the first is we don't have, from a financial standpoint, there is no possibility of changing our Callbell system. With that retrofit, we would be talking about millions of dollars, and that money needs to go towards other things to kind of encourage our patients in their discharge planning and all of that. We can't change our Callbell system. We do have Callbells that are specific to different kinds of needs. So for instance, there's such a thing as a light touch Callbell if a patient is unable to push this button. That is not going to be something that we are trying to address with this problem. The problem here is how can someone access this particular kind of Callbell? Your solution needs to be movable. We need to be able to move it from the bed to the recliner, even to a wheelchair possibly for a patient. The Callbell itself has a 7-foot wide cord, and I'll do a little demonstration about kind of the limitations with that within the room in my next part of my video. But that 7-foot cord does have to remain attached to the wall at any point in time. If it's not attached to the wall, it will not alert the nurses, and it's a moot point. There's no point in the patient having a call button at that point. The solution cannot cover the buttons on the Callbell, specifically the red buttons up here and the TV remote functions down here. You would not have happy patients if they can't access this part. This does need to be a solution that can be used with either left-handed or right-handed individuals. And bonus points are going to be given if this is an intuitive design to set up. We, from a rehab standpoint, have 55 rehab therapist professionals and an additional probably 60 nurses that are working on our floors. Doing extensive training for that many people is, as you can imagine, quite complicated. So if this is a solution that someone could pick up and be like, oh, I know how to use this, I know how to set this up, it's gonna be a lot more successful for our team. So for the next few minutes, I'm going to give you a little tour of what one of our typical hospital rooms looks like, as well as kind of how this Callbell system works. My hope is that as part of this project, you are going to be able to come into one of our rooms, but I did also want you to have the ability to kind of see this and revisit it as you need to.